Hello everyone! Welcome back to my YouTube channel. This is Dr. Gaile, and whether it's about dermatology or sharing a piece of my personal world, I'm here to bring authenticity and knowledge straight to you. I've already talked about what hormonal acne is, how to treat it, and I've also debunked myths surrounding it. So in this video, I will be answering frequently asked questions about hormonal acne treatment. What are the different types of hormonal therapies available for treating hormonal acne? Hormonal therapies are often a cornerstone in the management of hormonal acne, particularly in women. Let me talk about 3 of the most common options. First, combined oral contraceptive pills or COCPs. COCPs contain a combination of estrogen and progestin, which work by suppressing ovulation and subsequently reducing sebum production. An example would be one with cyproterone acetate and ethinyl estradiol. Second are anti-androgen agents. Medications such as risperidone and cyproterone acetate work by blocking the effect of androgen hormones on the oil glands, thus reducing sebum production and acne. And third are hormone replacement therapy. These are generally reserved for postmenopausal women. They aim to stabilize hormone levels, indirectly aiding in acne control. How does hormonal therapy work in treating hormonal acne? Hormonal therapy targets the underlying hormonal fluctuations responsible for acne. These treatments can, first, reduce sebum production by controlling hormones that stimulate the oil glands. Second, stabilize hormonal fluctuations. This leads to fewer acne flare-ups during menstrual cycles. And third, decrease inflammation. Through a reduction in oil production, there is a subsequent reduction in acne-causing bacteria and inflammation. Can I use skincare products or undergo skincare treatments while on hormonal therapy? Definitely. It is essential to maintain a good skincare routine while on hormonal therapy. Here are some best practices. First, use a gentle hydrating cleanser to maintain skin barrier function, which can sometimes be compromised with hormonal therapies. Second, avoid using a lot of irritating agents together unless advised by a dermatologist or healthcare provider. And third, before undergoing any skincare treatments such as chemical peels or laser therapies, always consult with your dermatologist who might adjust the treatment parameters based on your hormonal therapy. What lifestyle changes can complement hormonal therapy in managing hormonal acne? Incorporating a few lifestyle changes can enhance the effectiveness of hormonal therapy. These include maintaining a balanced diet such as reducing intake of dairy and processed food, stress management as stress can trigger hormonal fluctuations. Practicing relaxation techniques such as yoga or meditation can be beneficial. Regular physical activity. Engaging in regular exercise can help maintain hormonal balance. Are there any side effects associated with hormonal therapy for acne? And what should I do if I experience these side effects? Hormonal therapies, including COCPs and anti-androgens, can have side effects. Here are some common ones. Nausea, bloating, and abdominal cramps can occur, especially during the initial months of therapy. Changes in mood and increased anxiety have been reported, likely due to the hormonal alterations induced by these therapies. Breast tenderness and changes in menstrual cycles, which are fairly common side effects seen in individuals undergoing hormonal therapy. And lastly, vaginal spotting. This is a possible side effect, especially with COCPs, as they alter the hormonal balance. I highly recommend individuals on hormonal treatment to maintain regular follow-ups with their healthcare providers to manage these side effects effectively. Addressing hormonal acne involves a multifaceted approach that encompasses lifestyle modifications, skincare routines, and potentially medical interventions. Consult with a healthcare provider to ensure you get the safe and appropriate management for your condition. So that ends my video. If you like it and you want to stay updated on all things skincare, personal stories, and more, don't forget to hit that subscribe button and turn on the notification. Oh, and by the way, we are on our way to reaching 100,000 subscribers. Yay! So please guys, comment below with any thoughts or topics you'd love me to talk about in the future. Thanks for watching and see you again soon. Bye!